Hi, this is Dr. Kate, and today we're going to talk a little bit about cartilage regeneration, cartilage growth. So previously we thought you could not do very much for bone-on-bone joint pain, and that would be in any joint. In any joint we have cartilage that helps cushion, keep things moving nice and pain-free, and lots of times with knees, fingers, hips, you get some deterioration of that cartilage, and then you get that terrible pain, that bone-on-bone pain, where people will often have to get a joint replacement. There are a variety of cell regeneration things that you can do to help with that kind of pain. So the three things that increase cell regeneration are stem cell therapy injections, PRP injections, and shockwave therapy. Now, the only kind of shockwave therapy that stimulates cell regeneration is focused shockwave. We did a episode on the differences between radial and focused shockwave, but for regeneration purposes, you need that big amplitude of the focused shockwave to create cell regeneration. It's really important when it comes to regenerating cartilage. With the focused shockwave, we have to be able to get into the bone right underneath the joint space to increase circulation in there, and that helps to grow new cartilage. So where we previously thought as that joint degenerates, it just gets worse and we're not able to fix that. So we're looking at, in the past, people would have, let's say, knee pain. They would start getting steroid injections just to mask the pain and go on with their everyday activities. So they're trying to elongate the time that they have to avoid a knee replacement. The problem with that, and we have an episode on the negative downfalls of steroid injections, but it does thin out the cartilage. So even though it's giving you pain relief, it is going to make you need a knee replacement quicker. So it's really speeding up your journey to need that joint replacement. There are those different kinds of shots that are not steroids that you could try, and then your only option at the end of that journey is a knee replacement. There are stem cell injections which help to increase cell regeneration if there is cartilage left in the joint. And then there is also shockwave therapy, where you're increasing the circulation in that subchondral space in the bone and then stimulating new cartilage growth. It does take a while. It does take a 3-month course of care to get the best results. And then you see the most cartilage growth 3 months after that, because cell regeneration does take 2 to 3 months to fully happen. This is not a quick fix. Like with a steroid injection where it's immediate pain relief, we are trying to structurally change the joint. It is more permanent, it's healthier for you, and it's going to keep you from needing a joint replacement, it more so than a steroid injection. I have seen my colleagues that are in other areas that will dovetail with stem cell therapy, so they will get stem cell injections and then their provider will have them also use targeted focused shockwave into that subchondral space to also regrow the cartilage. So they're using both together. So it would probably depend on the severity of the joint degeneration and your price point. So when you're getting stem cell injections, we're looking more like at $5,000 range per knee, and focused shockwave for a 3-month course of care, you're looking more like $800. So that's looking at around $6,000, but it all depends on what you want out of your treatment. You just want to go ahead and get the joint replacement, with keeping in mind that those do not last forever. So if you're young and active and you want to put that off as long as possible, you would want to look for other options. I personally would probably start with shockwave therapy by itself, because we have seen unbelievably good results with just shockwave therapy and increasing that cartilage growth from the subchondral space. And if that wasn't getting you totally better, then I would add in the stem cell injection. So it's the same idea as with surgery. You're going from least invasive to most invasive in that order. But we've seen really great results. Personally, in our office, we treat knees every single day. We do really require that you rest. Now, everybody's different. Everybody responds to treatment differently. So in our standard, we really want you to rest for 24 hours at a minimum after you're treated. And if you're not getting the good results that you want, then we reevaluate. Do you need more rest? Are you dealing with something like a foot issue or something, and you're on your feet a lot at work or that kind of thing? You're going to need to rest more. Or it's going to take longer. It's going to take more visits. I like to be upfront with people and tell them that they need to rest. And if they don't want to rest, if they are a pickleball player or something that they just don't want to give up, I just let them know that it's probably going to take twice as long. Can we still make good change? Can we still really see good results? Yes, but it's going to take longer. Some other things that people will really want to keep doing, but it's going to make it a much longer process, is taking NSAIDs. We really do not want you to take NSAIDs while we're doing this, but we do have people that do still use NSAIDs throughout the process, and it just takes longer. It doesn't completely stop it from working, but it does take longer. Now, I talked a lot about knees, but keep in mind that we use this for cartilage growth in other joints as well. In the hands, in the feet, in the shoulder. Some areas that we are not able to address currently that would be really deep would be like the hip, depending on the size of the person. Our pads are super specific in how deep they go into the tissue. So the deepest that we can go into your body with our treatment head is 4 centimeters. Now, that might work for someone who's rather petite to get into their hip joint and target where the joint lines are at. But if you're more dense, it might not be adequate to get to that area. So everybody's different. That's why we have little rulers in every single room. We love to measure and try to be as specific as possible with our treatments. So what we previously thought with cartilage, it being not a renewable resource, is not true. And we have images and x-rays that will show the progression. A really cool knee x-ray pre-treatment, after the 3 months of treatment, and then 3 months after that. So it's a 6-month process, but you can see how the 3 months between the end of their treatment and their end x-ray with no treatment in those 3 months span is the most cartilage growth. It's pretty wild, it's pretty impressive, and it gives like a new hope to people that want to avoid surgeries like that. Now, some people have no issue with surgery. They don't mind. That is a route that they are willing to take, but everybody's different. Everybody's motivated by different things, and we're just happy that there is another option for people that really want to avoid surgery. I know I personally do this type of treatment on my hands. If you've been into my office, I do a lot of myofascial work and a lot of thumb abuse to myself. So I treat my own hands because I want to avoid any major arthritic issues as I get later into practice, because it is something that I love to do and I want to be able to do it pain-free for a very long time. So if you have something that you love in your life that you want to keep doing without issue, come see us, because we can definitely point you in the right direction or help you with that issue. So if you have any questions, let me know.